and hello everyone. Welcome to the Nursing Virus YouTube channel. This is me Loganathan and this video regarding the JIPMER Nursing Officer Examination key answer, which is everything based on the memory based question and answers. The exam was held on the date of 4th September 2022. So here more than 50 questions we'll see with the answers. And so far, if you have not subscribed my channel, don't forget to subscribe and click the bell icon. So here we'll go with the first question. So the first question, the gynecoid pelvis subpubic angle is option A 100, 45, 90 and 30 degree. So probably the gynecoid pelvis will be considered as a normal one. So the subpubic angle is 90 degree angle is the correct one. So next question.
Electroconvulsive therapy is given under the presence of which of the following? Laryngoscope, endoscope, intracranial pressure monitoring and BP apparatus. So here the intracranial pressure monitoring is much important during that electroconvulsive therapy. So the right answer is C. Third question. The child is adapting to difficult or a challenging life experience, especially through physical, psychological and emotional and behavioral flexibility and adjustment to the external and internal demands. The options are crisis, depression, resilience and grief. So here directly they said about the physical, psychological and emotional and behavioral flexibility. So it is completely related with the resilience. So next question, identify the rhythm at the given image. So given the ECG and they asked to identify what kind of rhythm is this one. So the options like ventricular tachycardia and atrial fibrillation and atrial flutter and ventricular fibrillation. So the correct answer will be the ventricular tachycardia. So on the image itself you can see there is a very short phase of one wave to other wave. So the person having the tachycardia. So the next one, the law or principle of physics is used in the pulse oximetry is Beer-Lamport law. And sixth one, the child with a post-traumatic stress disorder, the nurse will be expected to observe which of the following symptom on the children. So the correct answer is fighting. So the correct answer is frightening dreams and reenacting the traumatic events. The child will used to remember the past event repeatedly. So the next question. When performing two rescuer cardiopulmonary resuscitation, how often should you switch rescuer? Each cycle of the CPR, every 3 cycle, every 5 cycle and every 10 cycle. So the correct option is every 5 cycle we need to shift the person for doing a CPR compression. So the next question. The shortening of the children into the priority group according to their medical needs and the resources available. So this method is called as either triaging or grouping. So it is purely, we know that it is making the persons to get the care according to their severity of the illness. So that is known as triaging. So the next question. On the Burns client, the order of 2 liters of Ringer lactate is prescribed by the physician and it's need to be administered within 24 hours of period. The 1 ml drop factor is 15 drops. So what is the drop factor for this patient per minute? So the options are 21, 33 and 45 and 23. So we know that the fluid calculation formula, that is a total amount of fluid, that is 2000 ml into the drop factor, that is a 15. and it should be divided by the total time duration, that is 24 into, it should be converted into the minutes, so it is 60 minutes. So when you are doing this cross, that is 4 when you are dividing the 15, and again if you are dividing that 2000 for the 4 times, you will get 500, and when you are making short of this answer, you will get 20.8. So the correct answer is 21 drops per minute will be the correct answer for this question. So the next question, the glossitis is known as the following inflammations, that is a nose, mouth, and the tongue and the gum. So the correct answer will be tongue. So the inflammation of the tongue is known as glossitis. So next one, the WHO recommended dose of IPV for the children is 0.1 ml and 0.5 ml and 1 ml and 2 ml. So always that IPV will be recommended, that is 0.1 ml for the children's, that is a constant value. So the next question, again based on the WHO, the recommendation of the children's need to get that IPV dose. So the recommended dose by that WHO, so that will be at least 4 dose, either 3 dose or 5 or a 2. So at least the child need to get the 4 dose of IPV during their lifetime. So the next question will be, the abdominal examination is performed by the physician in dash position for the patient. So either it is a supine position, left lateral, Sims or prone. So we already, everyone knows that. So the abdominal examination can be clearly done by making the persons to lie in the supine position. So the next question, the tube used to decompress the stomach or the duodenum is Levin's tube. So the next one, the client given 40 mg of furosemide and he will be advised to take, so actually, so the potassium rich diet is necessary for this kind of patients. So they're given like a low fat milk and fresh fruits and vegetable and more fluid and more orange and banana. So actually that potassium rich diet is necessary for this kind of patient, diuretic patients. So here the two options will be look like more or less similar, correct, that is a low fat milk, and as well where we have the option like orange and banana. So the question answer is query only. So the next one, so one of the aptitude question, the eighth letter of the second half of the alphabets from the right third letter is W, X, Y and U. So here we can see the second half of the alphabets, that is from the 14. So count that letter 1, 2, 3, 4, 5, 6, 7, 8. So from this letter they asked the third letter. So 1, 2, 3. So that will be W. So that is a correct answer. So the next question. So identify the given image below. That is a laryngeal mask, airway, and perineal tube, endotracheal tube, and nasal catheter. So everyone knows. So when there is an infusion area, the inflating area where it is present, that is a laryngeal mask, airway. So it is very clear and easy question only. So the next question, the mirror therapy is used for the patient to treat option A, obsessive compulsive disorder, Alzheimer's disease, and phantom limb pain and the depression. So here the correct answer is the phantom limb pain. So when the patient is done any kind of amputation, the best therapy, the mirror therapy can be much helpful to relieve the pain. So the option C is correct one. So next one, an adult man is already having the tracheostomy and the nurse doing the suctioning in the tracheostomy tube, and the cardiac monitor shows that tachycardia and continuous alarming. And what is the nurse immediate action? So here, continue the suction within at least 15 seconds, stop the suction and reconnect the oxygen or ventilator, and C, immediately inform to the physician and stop the alarm and continue the procedure. So here, the immediate action to treat the tachycardia by the nurse itself, that is, stop the suction and reconnect the oxygen resource. So that will be the most appropriate answer for this question. So the 20th one, during early post-operative period after the thyroidectomy, the client is experiencing the corporal spasm when the blood pressure is taken, and the most expected sign due to this thyroidectomy and when the nurse is identifying the corporal spasm is, the options are tetany and reduce the level of thyroid hormone and normal after thyroidectomy. So the corporal spasm will be always expected, so whenever after performing the thyroidectomy procedure. So it is a major sign of the latent tetany. So the next one, after an intramuscular injection, the client complains that he has burning sensation on the site. What is the nursing intervention to reduce this problem? The one is applying cold application. So another one, applying the hot application. So according to me, the applying the cold application will be always best remedy for making that, treating the burning sensation in the injected site. So, and as well, the another option is like doing a massage on the injected site. So the next question, 22, the premature separation of the normally located placenta is known as abruptia placenta and placenta previa. So it is a most repeated question in that all the government exams. So that abruptia placenta is the correct one for the premature separation of the normally located placenta. So the next one, the normal amount of calories required for an adult. So here 40 calories per kg per day, 50 calories kg per day, 70 calories per kg per day, and 20 calories per kg per day. So that 40 calories is ideal normal calorie requirement for a healthy adult. So the next one, question number 24. A female client is receiving IV mannitol and assessments the specific to safe administration of the said drug is option A, vital signs every 4 hours and waning daily and urine output hourly and the level of consciousness. So whenever you are administering that mannitol, so the urine output is necessary to be monitored. So the next one, 25th, the target of maternal mortality ratio by the year of 2030 by the Indian government, 70 per 1 lakh population live birth, 30 per 1 lakh live birth and 50 per 1 lakh live birth and 60 per 1 lakh live birth. So the option A, 70 per 1 lakh live birth will be that target by the India in the year of 2030. So the next question, the neonatal mortality rate in our country. So the options like 20 per 1000 live birth, 26 per 1000 live birth, 30 per 1000 live birth and 24 per 1000 live birth. So the option B, 26 per 1000 live birth is appropriate answer for the NMR rate. So the next one, and 54 years female reported that on her every month self-breast examination she found soft, no palpable lumps So the nurse should explain to her how she can find out the cancerous breast. So the correct answer is palpable mass and the dimple of the skin and pulling in the nipple will be the appropriate answer to explaining about the cancerous condition to the female. So the next question. So which of the following laboratory value indicate the presence of infection on the client? So the options are WBC count 4000 per mm and WBC count 15,000 mm and platelet count 4 lakhs and neutrophil 55 to 70 percentage. So whenever the person having that infection process, so automatically the WBC count is an ideal one will use to get increased to fight against the infection. So the option B is the correct one. So the next one, the child will be assessed for the autism. So what is the most expected sign of this child? So the options are not making the communication with others and playing with the peer groups. So the playing with the peer group is the correct one. So this one will be done by the normal child. So the not making the appropriate communication will be the most prominent sign can be seen with the autism children. So the next question. After an immediate post-operative period, the nurse is teaching him about the coughing and breathing exercise. So what is the best position she can use to teach the procedure to the patient? So here the first option, keep the pillow under the head and make the supine position, and high follows position, prone position and lateral position. So here for any kind of an post-operative procedure, for keeping in one additional pillow and making the persons to lie in the supine position will be best one to make the coughing and breathing exercise. So that way we can avoid the aspiration. So then the next 31. A female client is admitted with the diagnosis of acute renal failure and she is awake, alert, oriented and complaining of severe back pain, nausea and vomiting and abdominal cramps. Her vital signs are the blood pressure 170 mmHg, pulse 110, respiration 30 and the normal temperature. Her electrolytes are 120 milliequivalent per liter, potassium 5.2 milliequivalent per liter. Her urine output for the first 8 hours is 50 ml. The client is displaying sign of which of the following electrolyte imbalance? That is hyponatremia, hyperkalemia, hypercalcemia and hyperphosphatemia. So here whenever you are looking at all the signs, this everything will be considered as normal one. So only the one thing is abnormal is the sodium. The sodium normal value we know that is the 135 to 145. So the problem is low level of sodium, so that indicate for the hyponatremia. So the next question. The client brought to the emergency with an accidental injury. The nurse need to keep the wound with the following dash before seen by the physician. That is what kind of dressing need to be done before the physician sees the wound. That is a wet dressing with a normal saline, dry dressing and bovidin iodine wound dressing and keep the wound open. So most probably that dry dressing can be done for the client, so before the physician sees the wound. So the next question, 33. Hypertensive crisis will be treated which of the following medicine? That is a lithium citrate, labetalol and potassium chloride and sodium chloride. So the primary drug of choice for that hypertensive crisis will be the labetalol according to the given option. So the next one, on the diagnosis of the fracture patient during the discharge time, the nurse asking the family members to give the cold application on the affected site. So what is the rationale of the above procedure? You will explain to the the family members. That is, so the cold application will be always make that vasodilatation and will make the wound for the better healing and to relieve the pain. So next one, the remains of Vijayanagara Empire is, so which is located in the Hampi, Karnataka. So next one, the client will be administered digoxin and the nurse knows that the client need to be monitor potassium level, and the reason for doing that serum potassium level is to avoid the toxicity of the drug. So this is the best remedy to monitor the potassium level whenever you are administering the digoxin. So next one, the epinephrine need to be diluted with the concentration of 1:2 lakhs ratio, and the 1 ampule of epinephrine need to be diluted in how much amount of 5% of dextrose or the normal saline. That 250 ml of normal saline or 5% of dextrose will be used to make the 1 ampule of epinephrine dilution. The next one, the client is being diagnosed with a leukemia. The client is undergone for the bone marrow aspiration and he will be likely to expected to increase in which of the following cell. That is, excessive amount of abnormal white blood cell can be seen in the leukemia condition. So the next one, at birth, so which vaccine will be administered? So according to the given option, that is a pneumococcal vaccine, hepatitis B and rotavirus and covaxin. So according to the given option, the hepatitis B will be administered during the time of birth. And another one is TCG. And the next one, the female is having the two separate uterus with a single cervix and vagina is known as bicoronate uterus, unicoronate uterus and arcuate uterus and separate uterus. So here you can see the images of a unicoronate and bicoronate uterus. So according to that given scenario, there will be an two uterus and the one cervix and vagina. So the bicoronate uterus is the right answer. So the next question, the causative organism for the endocarditis Pseudomonas, Streptococcus, Escherichia coli and Klebsiella. So the correct option is Staphylococcus. So it is the most causative organism for the endocarditis condition. So option B is the correct one. So next question, name of the probe used for the e-fast ultrasonography during the trauma patient. So the options are linear probe and cardiac probe and curvilinear probe and pulse oximetry probe. So the correct probe is, that is a curvilinear probe, so which is commonly used in the e-fast electrosonography. So the next one, during pregnancy, the woman will be checked for the alpha fetoprotein test to detect which of the following condition. So the options are RH incompatibility, neural tube defect and oligohydramnios and polyhydramnios. So the alpha beta protein will be checked always to detect the neural tube defect, so during the pregnancy period, so which will used to happen due to the folic acid deficiency. So next question, the client has been admitted with a cancer and undergone for the chemotherapy and he shown the symptoms of septic shock on the following 8th day of treatment and he had developmental of diarrhea and chills. And what is the other most expected symptoms of the septic shock? So the tachycardia and hypotension and mild fever is the other expected symptoms on the septic shock patient. So the next question related to that aptitude side, that is Lufthansa belongs to which country airlines? That is a France Germany, USA and India. So Lufthansa is the airline by the Germany country. So the next one. So what is the shockable rhythm? They are given the four option. Among that, the ventricular fibrillation will be the shockable rhythm. So in the next 47, the client will be coming with the diagnosis of leukemia. On the laboratory investigation, which of the following cell will be increased? That is, options are leukocytosis and lymphocytes, neutrophils and basophil. So according to that given option, that leukocytosis is the correct one. That is increased WBC count. So the next question, there is the client blood pressure was 90/60 and his intracranial pressure is 18. And what is the cerebral perfusion pressure? So this is the question. So for identifying that cerebral perfusion pressure, so this is the formula, that is a CBP equals MAB, that is nothing, that is a mean arterial pressure, then intracranial pressure. So here the mean arterial pressure can be calculated by systolic blood pressure plus 2 into diastolic blood pressure divided by 3. So that systolic blood pressure is 60 and diastolic blood pressure is 60. So you can put on the calculation and you will get 120 per 30. So that mean atrial pressure is 70. So again, for calculating that cerebral perfusion pressure, we need to minus that intracranial pressure. So the options will be, the correct option will be, the cerebral perfusion pressure is 52 mm of Hg. So the next one, the granulation will occur in which phase of wound healing? That is proliferation, hemostasis, remodeling and inflammation. So the granulation process will always occur in the proliferation stage itself. So the next one, on the twin pregnancy, the one fetus does not develop the normal blood circulation and the heartbeat, and the baby is still getting that blood from the placenta. And what is the condition is known as, that is the acardiac fetus, dizygotic twins and monozygotic twins. So the correct option is acardiac fetus. The fetus does not having the heart, so that acardiac fetus will be the correct one. So the next question, the patient is given the 10 units of insulin with the 50 ml of 5% of dextrose. So this will be given to control which of the following symptom? That is hyperkalemia will be the right one. So the next one, again the aptitude side. So one person is meeting his friend on the 23rd 8 2008 Thursday, and he want to meet his friend again back on the 2009 on the December, and that will be only on the Saturday. So what is the probable chance of date on the Saturday during the December month? So the correct answer is 5th, 12th, 19th and 26th of the December month. That is also in the 2019 on the Saturday. So there will be on 4th Saturday on that particular month. So the next one, identifying the missing image in the given picture. So based on that, some shapes they given and they asked, so what is the missing picture on this image? So just we can make the ulta of reverting the bottom. Reverting the bottom will get, so this number. So this is the correct option. So and these are all options which I remembered during that JIPMER examination. So if you are remembering any other options or the further questions, you can write on my comment box or to my WhatsApp number. So this is my WhatsApp number. So there may be some corrections on these options or with the answers. So because it is completely memory based question and answer. And thanks for joining with me. Thank you.